So my name is Dr. Vaishnavi Pradhan, and today I am in conversation with Dr. Priyanka Bajaj. She is the manager of health and innovation at Impact Lab PAT. So ma'am, how are you feeling today?
I feel very wonderful, excited to see all the insightful presentations by the experts. But more than that, because that we get to see a lot, and it's always wonderful to be in gatherings where students are there. Because the topic specifically here for me was reimagining healthcare delivery. I think younger minds are most trying to reimagine. They're still tuned to a certain way of thinking and imagining things. So it's wonderful to be here.
Okay, so I mean you have a decade of experience in the healthcare industry, and you started as a microbiologist. So coming from a background of microbiology, so where do you see the antimicrobial stewardship for that matter? Where do you see uh, the hospital addressing it, or are we taking care of it properly or not? So how would you address it?
The very unfiltered answer to that is we were not taking care of it. We are a slightly better position now. We realize the problem much better now than we used to 10 years ago. There is a solution that even I was trying to make for point-of-care diagnosis of AMR, and I see that transition in the ecosystem. We realize the importance of stewardship. We now are thinking about infection prevention and control, because prevention is always better than cure. In terms of how we are doing in the prevalence of AMR, I think we need more data to substantiate where our efforts are going, that monitoring and evaluation, and accordingly guide the policy to the right direction, whether we need more diagnostics. Getting newer antibiotics is the most challenging part, because if you know the technology side of it, if you know the science side of it, you would understand that new scaffolds are not as easy to find. We've not been very successful in doing that. So, as much as we can do to promote rational use of antibiotics for a more, I would say, a reservoir which is available for our next generation is where our focus should be.
So having said that, I mean, now today we are talking, more about technology and innovations and everything for that matter. So can we look at it? Can we have like AI implementation or some technology to incorporate, have better AMR understanding? Suppose a chatbot system where which can like provide us the information before we prescribe a like antibiotic to somebody. Can we have something of that sort, a technological adaptation that could implement it?
I think it's a very good question. The answer is not as simple. I really wanted the answer to be very simple for that. The reason being, AMR is not just like, say, diabetes or hypertension. It is in n number of bacterial and fungal pathogens. We can have a manifestation of that in viruses also. And there are multiple mechanisms. I think the first step will be to have a simpler diagnostic mechanism which can be used right at the point of care, because that's where the entry point for resistance dissemination starts. I see, I mean, we all would agree that patient walks into a clinic, the doctor prescribes the antibiotic first, because they don't want to delay the treatment. Culture takes at least 2 days. Molecular testing is expensive. It still takes around 90 minutes for one of the fastest equipments. But when we say rapid point of care, it comes down to that 30 minutes till the time the patient enters. They are there in the OPDs when the sample should be in and results should be out. So that's where technology can come in. AI is an add-on to that. I think in antibiotic resistance, AI should be considered as a luxury, not as a necessity. We can have chatbots with that amount of information all of us have. I think layperson also has that information, but still they walk into a chemist shop, ask them, I have a bad stomach, give me a fluoxetine, and they also give it. So the implementation is where the problem is. Incentivization of the right kind of technology development is where we need to have our focus. AI definitely can enable wider spread specialist is not available, generally, CMO or even a pharmacy practitioner can at least refer to some guidelines before giving the antibiotic out.
So, I mean, having a set of incentives for that matter, do you think that the Indian healthcare system is providing enough incentives in that direction of R&D or something? I mean, it would be a very controversial question anyway, but what would you say about it?
Like I said, we've come a good long way. At least we realize the importance. For AMR, there is a specialized focus area now also. And it is so with other diseases also. We shouldn't thank COVID, but this maybe it was the silver lining on the entire pandemic that our focus has moved to health. The incentivization has come to a level that R&D is promoted. The early stage is very well taken. Here, if you look at Indian ecosystem, look at global ecosystem also. I think where we need more support. Here, in fact, that was our problem statement to start with. Is once we have a prototype, what to do with that? Where to translate it from lab to market. So that lab part, prototyping part is a more secure place. I think we should think about steps which are beyond prototyping for a solution which comes to the public health system, which comes to the market, which reaches in home of the people, which we are lacking.
So I think we have had like a good chat around how this. I mean, in a previous session also, I heard that things are being done at the grassroots level. The research part is done, but to market these things, we need revenue, resources, and now we should start working on that. So to end this, like, will you tell me one of the best technological adaptation that has happened over the time, that maybe pre-COVID or post-COVID, which has improved our life? If there are any examples in your
I would not want to sound conflicted for the technologies that we work with, for the ones that we don't work with. So I think I'll take up a platform. I think we've been very successful in bringing molecular testing to the common public. I don't think any one of us has heard about RT-PCR before COVID. People who were not from the scientific background, I'm not aware of them knowing about it. And now RT-PCR are available even in, say, private small labs. That brings in that accuracy of testing. It doesn't leave a scope for apprehension or scope for errors. It is expensive with time and with research. It should come down to an affordable price point. It should come down to instruments which can be taken to the field rather than people coming to a lab and a technician doing it. But I think I'm very hopeful to the promise of molecular testing.
Thank you so much, ma'am. It was great hearing from you, and I hope we have further sessions with you in the other conferences or other webinars ahead. So looking forward to having more sessions like that. Thank you so much.